growing pains.
Right, right.
See, parents have an issue. My
Yeah.
child is not growing, first point.
Correct.
Next issue is my child is crying every day night
Everyday night.
with
Yeah.
leg pains.
Correct.
Right? The
Correct.
child is crying every day night
Yeah,
with leg
yeah,
pains.
yeah.
He's kicking his legs. He's
Yes.
crying. We have to press
Yeah,
his legs
yeah,
every
yeah,
day.
yeah.
What is your thought process about it?
Correct. So, because I would say that, growing pains are pretty common in children, and especially after having like periods of physical activity, especially in the nights, they come with a bit of cramping kind of pain. Vitamin D deficiency is quite common, what I see. Like almost every child that that we test for has like low vitamin D levels. So, first, like I feel that, growing pains, like let's first correct the vitamin D deficiency and check his calcium requirement, like if he's like having good amount of calcium from his diet, well and good.
Good.
Otherwise, like probably may have to use supplements during the period of the vitamin D deficiency.
Okay.
And if these two parameters are corrected and like still the child continues to have these pains, then the next thing would be like maintaining a good hydration. And probably I would say, like, in after this intense physical activity, probably like, some stretching activities or massaging would be more helpful.
Would be more helpful.
And I think
So ultimately,
yeah,
is vitamin D has to be looked into.
looked into
Sources of
yes,
vitamin
yes,
D. So
yes,
major
yes.
source, according to me, is the sunlight.
Sunlight. Yeah.
So ensure that the child is outdoors
correct,
at least for 15 to 30 minutes.
Yeah.
Timing would be 9 to 3. That's
Correct.
what I would advise.
Yeah.
There's something small as a kid. I will just add it. I'm sorry, I'm adding into you. Because in my grandfather, who is a veterinary doctor, though, he was very interested in our natural. He used to give us these cod liver oil capsules.
Okay.
Which is another rich source of vitamin D.
Yeah.
So a lot of other things just to add to the data.
Yes,
so that is something which actually helps. So
Yeah,
you need to figure out what are the diets which help you out.
Correct.
Sunlight is a natural source, free of cost.
Yes.
You don't need to purchase
Correct,
anything with it.
correct.
That is something which we
Yeah,
can get
yeah.
in. So let's add on to it, because I believe after you coming in and associating with me, it actually helped us in identifying a lot of clinical cases, difficult cases.
Okay.
I had recently sent you a case where the child was actually looking like a 2.5, 3.
Right.
I assumed he was 2.5, 3,
Right.
and I was surprised that he was almost 5.5, 6 years of age. I think I've sent it to you.
Yes.
And I think you can just go forward, because that's a
Yeah,
shocker. Because the child, poor guy, was looking too small. I immediately asked him, is it 2.5, 3?
Yeah,
Parents said,
yeah.
no, sir, he is in second standard.
Yeah.
He's 6th class. I mean, 6 years almost.
Yes.
Immediately I said, no, he needs a visit.
Right.
Immediately sent to you. I can just
Correct.
tell me, how did the child progress?
Yeah. So the parents came to me that day, and I asked, like, how the child has been growing, and especially like they gave this when I asked them, like, is he outgrowing his clothes? And they said, no, the same clothes that
The
you
same
know
question,
what,
I think.
same
Yeah,
clothes
yeah.
like what he has been wearing as a 1-year-old have been still fitting him or so.
That's surprising, right? Yeah.
So that itself was suggesting that he was not growing in between. And again, I asked, like, didn't you realize that, your child is not growing compared to other kids? Because he was clearly looking as a
True,
3-year-old kid
true,
when his other friends might have been a little taller. So they said,
Same thing
like,
happened with me also, right?
yes. So they said, like, probably because one of the parents or the relatives was short in the initial years, so they wanted to wait it out whether he would grow. But then very good that the timely referral came that, we could actually do a growth hormone stimulation test in the child, and he actually turned out to be a growth hormone deficiency kid.
Okay.
And we had to, and the parents were like very anxious about the
This height
diagnosis and like what is the for the treatment. So when we counseled them about growth hormone injections, they had the reservations, like, about injections being given every day. And then a lot of counseling happened, and they started on the injections, and the child is doing quite good.
So when is growth hormone deficiency is something, picking up at the right age also is something.
That's very important.
So when is the earliest? I think it's very difficult. Every year you monitor growth.
Correct.
When is the age when we feel that after that there is no point?
Yeah, that's important.
What age do you think? Because the bones fuse. Can you tell us, elaborate at what age is the thing where we can't do anything more?
Anything, right. So usually, because many times, like even 18 or 20-year-old kids come and they say that, we want to take growth hormone.
Yeah.
And then
everybody wants to grow taller.
Yeah, everybody wants to grow taller, irrespective of whichever age they are. And then, we have to explain them that, usually by 14 or 15 years of age, the growth plates are like 99.9% fused.
So anything we want to act, it
Yes.
should be before 12
Before,
to 14 years of
yes,
age.
yes,
I
before
want it.
12 to 14
The
years
child is
of
not
age.
growing well, please
Yes.
ensure that you visit your pediatrician on
Correct,
regular
correct.
basis, check for his height,
Yes.
clothes are not becoming short,
Short,
have a
yeah,
concern,
yes.
and get himself checked for any
Correct.
growth hormone
Yes,
problems.
yes,
And
yes.
earlier,
Is the
the
better.
better.
Yeah,
That's the
yeah,
bottom
yeah,
line, something
yeah,
which
yeah.
we should be really
Correct,
concerned about.
correct.